Hi everybody and welcome to QITalktime. It's Roisin here and we've Dr. John Fitzsimons with us today. He's going to do a talk on sustainability and spread. So thanks a million for joining and we look forward to an exciting and interactive webinar today. So just a couple of introductions first. So Dr. John Fitzsimons is a consultant paediatrician in Our Lady of Lourdes in Drogheda, and he's also the clinical director for quality improvement in the Quality Improvement Division here in the HSC. So he's trained in PEDS, and he also was a patient safety officer with the Institute of Healthcare, the IHI, in 2009, and became a fellow of the faculty at the NHS Institute of Improvement and Innovation for 2 years. So since September 2013, he commenced a half-time post as clinical director here for quality improvement within QID. So he's very busy working on a number of different projects. He's the chair of a group that was established for the NCEC Paediatric Early Warning System Guideline, and he is also the course director. If any of you online have done the diploma, please let us know actually in the chat box if you've done the RCPI Leadership and Quality in Healthcare Diploma. That would be great if you could let us know. Also, if you can type in the chat box where you're dialing in from, it would be great to get an idea of where everyone is across the country. A couple of quick instructions. So if you're listening over the computer, that's fine, but sometimes people find the telephone number is better for sound. So the telephone number is there with the event number, and you just put a hash at the end of that. The chat box is up at the top right-hand corner. If you have any questions or queries or comments throughout the WebEx, please type them in there, and we'd be interested for those and have time at the end to answer any of your queries on sustainability and spread. It's great. We've someone from the north joining us, so that's fantastic. So without further ado, I'm going to hand over to John. And just lastly, we are active on Twitter at QITalktime is the handle, okay? So thanks, John.
Thank you, Roisin, and good afternoon, everyone. And it's a pleasure to be here. And thanks, Roisin, for setting it all up, and let's get going. So we have some outcomes here, really, that I hope at the end of the session we will have accomplished. So, you know, by the end of the session, you should be able to define sustainability and spread within the context of improvement. I'm going to talk a little bit about what the challenges and conditions that influence sustainability and spread are, and then we're going to talk about, you know, some of the interventions, models, and tools that support sustainability and spread. So in that respect, you know, sustainability and spread are just another dimension of quality improvement, and they have their own, you know, ideas, principles, concepts, and tools that will help us accomplish what we need to. And then I'm going to share with you some resources, some of the resources that I've used in pulling together this talk, and unfortunately, there's no magic wand here, you know, and at the end of this is really quite a bit of work, I think, for teams, because as my colleague on the diploma, Paul Rafferty, says, you know, we get 10% of the marks for making the changes, but we get 90% of the marks for making them stick and making them sustainable, and then spreading them to places that haven't yet tried those. So where will you go? So, you know, for people who've been engaged in quality improvement, you'll have been busy doing some tests after you've had your ideas, and you're going to be doing those tests through using PDSA, Plan, Do, Study, Act cycles. But there reaches a point where you know, you believe you've found the right solution to a problem you were trying to solve, and the question then is as you kind of move on to something else, or you need to diversify, is how is that change sustained? And unfortunately, for a lot of changes, once the foot is taken off the pedal, the change falls away. So how might we do something that keeps those changes there? Everybody's familiar, I suppose, at this stage with the conceptual kind of process of improvement. So we start small, you know, through identifying kind of what are the key ideas that we want to test out. We test them literally one at a time, one day, one patient, one doctor, one nurse, one environment. And from that, we build up a level of knowledge, and then we implement that at a larger scale. And sometimes we talk about that implementation phase as scale-up. And throughout all of this, we're using our PDSA methodology to learn what works, what doesn't, and we adopt or discard whatever we're doing. And then we reach this phase of when we know what it is we want to do, well, how do we sustain that, and then eventually how do we spread it to other places? One of the sources that I kind of drew upon for this talk is a book by John Fitzsimons called Management on the Mend, and he is a leader of theater care in Wisconsin, which is a big lean organization, and they talk about this testing and implementing has been the model cell, where you really learn what works and get everything absolutely right in that one place and then spread it. So here's the definition. So sustainability simply is locking in the progress made and continually building upon it. So not saying even though we've decided that something is good enough to sustain, it doesn't mean that it can't be improved upon or changed at a later stage if someone has good ideas or new information comes along. And then spread is the active dissemination of best practice and knowledge about every intervention and implementing every intervention in every available care setting. So, you know, not limiting it to one part of the organization. And I suppose in my work where I do get to travel sometimes and see what's going on, I often find people have solved the solutions for national problems in one part of the health service. And you know, one of the things we could do better is spread really good ideas and solutions from places that have cracked kind of generic problems that we all have. So here's some challenges for sustainability. I'm sure you've heard all of these as well. It's not just me. You know, we're just too busy to keep going. But sometimes, you know, people will say, well, you know, we did the diploma last year, or we did a quality improvement course, and we really enjoyed it. But now, you know, we've got to get back to our real work, and we're just too busy to keep on doing this. You know, another thing I've heard is the guys doing this work, well, they've all gone. So, you know, we had, you know, we'd solved the problem, but the people who had done this had, you know, have now moved on to other jobs or other places. And one of the things, you know, when we're coaching in quality improvement, we often ask people is, well, what happens when you go on holidays, or if you were sick for a week or a month? You know, who would do this job? Because, you know, we always have to build in the possibility that people do move on. Here's another one. We fixed it, but nobody seemed to notice or said thank you. There's nothing worse, I think, for sustaining improvement than creating the belief that nobody really cares too much about it. You know, so I think a really simple thing is acknowledgement and just saying thank you, and you know, reminding people how important that the work they do is. The old way was easier. This is a really tough one, you know, because I think if you are not making the work easier than what was the previous case, then it will not sustain. You know, you may be offering an improvement, but you know, quality improvement, you know, one of the real principles of it is making it easy to do the right thing. And one of the things has to be that it's easier than doing things as we currently do them. No matter how good the return is, people cannot generally do something that makes their life harder or requires them to do more work. And then finally, we've moved on to something new. You know, often there's a lot of excitement in solving a problem, showing that we can do something, and the part of sustaining it, unfortunately, is just a bit less attractive. And for many people, you know, you know, it's solved or soothed their curiosity to know that they can improve something, whereas actually, you know, they're less interested in sustaining it. And that's not a problem. I think we have to respect that. You know, sometimes people who have great, you know, skills around innovation and you know, adopting early practices are not necessarily people who want to go on and continue to do something. So we need to recognize that and make sure that we build in systems and bring in people who are good at sustaining things. So here's some critical success factors, I would say, for for sustainability. Like I said earlier, like all of quality improvement, it's based on theory and methods, like Dr. Deming used to say, what's your theory, what are your methods? And so we're going to talk about some of the theories and methods underlying both sustainability and spread, and then some tools that flow out of those and some approaches. I think one of the key things for sustainability is the constancy of purpose of leadership, and the need to build in governance in the form of accountability, so that not just solving the problem but sustaining that solution is the important thing, and having a way of continually knowing that a problem that was once solved remains solved. Essential, and again, we'll throw up some ideas here for practical things, but around measurement, feedback, and acknowledgement. And the type of feedback we need when we're doing improvement work is different from the type of measurement and feedback we need when we're looking at sustainability. At the beginning in improvement, we're learning and seeing do the things and the ideas that we're testing out, do they work. Whereas actually in sustainability, we want to make sure that they're still working and they're continuing to be implemented. Education is critical here. Again, like in all improvement, it's not the only answer to improvement, but it is a critical part. And then the final part is and I think this is probably the key, one of the key messages today is the importance of a high-performance management system. So, you need to kind of hand over the work of improvement, which is often about doing things differently and new things into a system that is able to manage the day-to-day demands that continuing to sustain an improvement require. So I just want to remind everybody, I'm sure everybody's heard this one before, that this is what we call the first rule of quality improvement. Every system is perfectly designed to achieve the results it gets. And it's exactly the same with sustainability. So if we don't design a system that is sustainable, then we won't have sustainability. So don't be surprised if your quality improvement initiative is not sustained if you haven't thought about sustainability and designed it in. And so here's some ideas around that. What does the system for quality that is sustained look like? Well, I think when I got interested in quality improvement, I was only really interested in the top part of this triangle, and indeed a lot of people were only talking about the top part of this triangle. This is called the Juran Trilogy, named after Joseph Juran, who, along with Edward Deming, was one of the pioneers of what's kind of seen as modern quality improvement methods and ideas. And Juran said, yeah, sure, quality improvement is important, but there's other parts here to it. We need to have something called quality planning, where you actually, think about what it is you're trying to achieve, plan out the steps. And then once you've done your improvement and implemented it, you need to have this phase of what's called quality control. Now, quality control is a funny word because it often gets confused with quality assurance, and they are not the same. They occupy some of the same territory, but they are different things. Quality control is an internal method for making sure that you're continuing to do the work and the processes and the ideas that were agreed upon through testing and quality improvement. Quality assurance is an external process whereby you are giving assurance to an external body that what you're doing is the right thing. But quality control is very much about learning and continuing to adapt and change the system as needed. And this kind of schematic, it's obviously the same Juran Trilogy, but the point I'm trying to make here is that all of these things are not independent of each other. There is some overlap here, and they all coexist at certain times. And this is a little model. It comes from what I think is one of the key references of today's talk, which is the IHI white paper in 2016 on sustaining improvement. A really, really good resource. Lots of really important learning in it. But you can see at the top there is the idea of quality improvement with our PDSA. model at the center of it. But when we've decided on, what the improved design is going to be, then we move into this phase of quality control, and that's got a slightly different cycle there. So it's agreeing on, what they call their standard work, so that this is the way we're going to approach our work that we've agreed upon through testing and our quality improvement methods. We do it, we keep an eye on it, we monitor it, and then if needed, we adjust it. And we adjust it because maybe the circumstances changed, or maybe the context is different. Maybe there's new information or knowledge that suggests that we go back and maybe move back into quality improvement phase. Maybe from our monitoring, we find that what was once working is no longer working. We need to shift back into a quality improvement phase to try and readjust kind of back to find a form of standard work that works. So again, it's toggling between this quality improvement, quality control. So here are some steps, I would say practical steps for sustainability. The first one, and I put this first because often people put this last, but I think that, it's so important, and it's relatively easy to do once you're aware of it, is acknowledge when quality improvement has happened and celebrate, to put it out there as something that is, to be celebrated and acknowledged in our team, because there's nothing worse than just ignoring really good stuff that's happening. And celebrating, I think, often it's just telling people that something good has happened and acknowledging the work that's done throughout the team. Leadership clarity and responsibility, that's really, really important. Again, sustainability is not going to happen unless that's there. And it's not an accident, that projects are sustained. So thinking about that in terms of roles and responsibilities. Designing the work for sustainability from the start. I think that's a key lesson of sustainability. I think when people often kind of get into quality improvement and try it out first, they probably don't think that far away. They're really just trying to find the change that's going to work for today. But I think as you become a more practiced improver, I think this is something that really needs to be thinking is how does this work go on without me? How does this work become something that's easier to do? And I think you can't get away from the idea that a huge amount of this is about redesigning the work to make it easier. And there are some ideas here. I think, one is you don't have to start afresh, to use your quality improvement toolkit, that you'll have learned, and these are kind of basic skills that most people will have come across. Just going to look at a couple of these. Great resources here are looking at the framework for improving quality and some of the resources that QID has. So the framework itself, and then the improvement knowledge and skills guide. That really, is a great resource for pointing people towards these tools and ideas. And all of the drivers in the framework there, leadership, person, family engagement, staff engagement, etc. They're not only are they the drivers for quality, they're also the drivers for sustainability and for spread. So they can be very helpful in that respect. So driver diagram there is something that we use all the time to really just put down, what our theory is in one place. This is an example from the Pressure Ulcers to Zero collaborative, so spreading the skin bundle, which is the bundle of care elements that leads to a reduction of pressure ulcers. You want to spread it to all medical and surgical wards. So you can see there that we're into kind of thinking theoretically about how we would spread something. Equally, we could say how we're going to sustain it. And then from that, we're going to pull out what are the primary drivers. From the IHI white paper in sustainability, this looks a bit scary and there's a lot of detail there, but I really want you just to look at the what the primary drivers that they've identified there are. So, what they're trying to do here is sustain an improvement So the primary drivers they've identified are the quality control elements. So how do we know that the work that's meant to be happening is happening, that it's standardized, that we're doing it, that we're monitoring it, and that we can adjust it if needed. Quality improvement place, how do we slip back into that quality improvement phase when we need to. And then finally, the third major driver there they have is creating a culture of high performance management, and that requires certain key management structures, and we'll talk a little bit about that later. But it certainly requires, in terms of the culture, it requires leadership to decide on it. So again, none of this is happening here by accident. Sustainability is planned. Another tool that's really useful here, again, specifically looking at sustainability, is our stakeholder map. So again, on the top bar there, degree of enthusiasm and degree of influence, and then we can map various people onto that, and know what our role is to them, so that we want to bring everybody along. And of course, the important thing about a stakeholder map and stakeholder analysis is that people don't have to stay in the box they're in. We can look at how do we move them into the place that they need to be, specifically for sustainability or spread. So again, another simple tool that can be used as you're doing your quality planning for sustaining and spreading innovations. Communication plans again. So again, looking at what are the messages that people need to be getting. Who's the audience? What's the purpose of this communication to them? What are the key messages that they need to get? Where are we going to do this? How frequently will we do this? And who's responsible for doing it? So again, planning out the approach to sustaining and spreading quality. One of the big things that comes through in talking about sustaining and spreading change is this idea of creating standard work, and I think this is one of the only ways that we can create sustainability, because if we've got to reinvent things all the time, then it just becomes impossible to do that. And so I wanted to share some ideas. I think one of the key ideas is around this idea of creating a daily management system. So we've created a new way of doing things, and we've tested it out. We know it works. But what we need now is some form of daily system that allows us to know that it is working and to address any problems that might come up in it. Daily management system is something that comes from Lean. I don't think it's exclusive to Lean, and I think it's certainly an idea that can be adapted without knowing a lot about Lean. But I think there are some good ideas here, and this comes from John Fitzsimons, again, who talks about a daily management system is defined as a standardized work at all levels of management to enable daily dialogue about the most important facts of the business. And the business, I suppose we're talking about here, is simply how to do the care that we need to do each day. And it's designed to ensure that everyone is working on the right problem. So it's just a way of ensuring, it's a structure in one way of ensuring that the right communication, the right people are brought together to problem solve and sort out things as they need to. It's often helped, as you can see, the participants there, standing around a visual board, and I'm sure many people will have experience of visual boards from possibly the productive ward or other kind of Lean ventures where, things like patient flow are really assisted by having patients on a board, and then knowing what's due to happen to them, where they're meant to be going, what's meant to be done through the day. And that's something that allows everybody really to have a shared sense of what's going on. And building kind of, our new improvements into these daily management systems is really key to sustainability. This is a very simple example. Many people will come across. It's called the safety cross. This is something that can be used daily. So these are days of the month here, and this was something we were using in the Pressure Ulcer Collaborative. So if there was an injury-free day, you got a green. If there was a transfer into your unit with a pressure ulcer, you got a yellow. And if there was a new injury, it was a red. And it's a really simple visual system for knowing exactly how you're doing. So this is one that's completed here. So it's the month of September. It's so many days since the last injury was reported, and there was one new event and one transfer in. So again, you know, it allows everybody to know what's going on, and to, at set times, maybe it's every day or every shift change, to talk about the plan, maybe, you know, to talk about the skin bundle or something new that we're trying to sustain. Run charts then are another way of measuring and continuing to look at changes over time, and people are familiar with them, and you can, you know, add in various kind of annotations to let us know what's going on, and you can even turn them into control charts where you have a greater degree of knowing whether you're in control, which is that idea, you know, of being able to measure to say that we have quality control. This again is a scary looking kind of matrix here, but again, the purpose is really only just to show the planning that is needed really to support, I think, sustainability. And this is very much a management approach. You can see that broadly the slide is divided into two. You've got your quality control operations over here. So the first column are the key tasks that are done by various levels of management. So you've got your patients and families down the bottom there, and your frontline nursing staff, and then going up there you've got your various management levels, and each of them has really kind of prescribed tasks to do. And then on the other side we've got our quality improvement tasks, and again, and then looking at what data is needed for control and what data is needed for improvement, and then how do we, on this side, how do we kind of provide guidance to ensure that that quality control is happening, and over here, how do we kind of align these aims to other things that we're doing. So the idea here is that everybody knows what's going on. I think the most important group here are our frontline people, and they know exactly what their tasks are, what the data they need to be gathering on a daily basis, and put some guidance here on how to use that. And then over here, again, it's the key tasks for when we move into quality improvement mode. So again, that's in the sustainability paper. It's difficult to take in, and I think in one go on the slide, but there's a lot of kind of good sense there if you have a look at this. And again, I think the headings here certainly are something useful that people could start to look at. You know, what are the key tasks that each of us need to take on to make sure that we're keeping things in control. Another concept I just want to share with you is this idea of training within industry. Now, this is something that has been taken up very much in lean thinking, but actually it predates it. It comes from throughout kind of the kind of industrial sector, including healthcare in the Second World War, where people were being brought into the workforce who hadn't previously been brought into the workforce. And how do you train people up very quickly to do certain jobs? And it's a way really of educating people in terms of doing jobs. And at its most basic, it has three elements. It's called job instruction, where the tasks that people do are to be broken down so that, you know, they can be really understood what the key parts of those tasks are. Job methods, which is a way of people critically evaluating their own job and kind of looking for ways to improve it. And then job relations, which is this idea of other things that supervisors and managers and people who would be, I suppose, observing and ultimately responsible for work, how can they best support and give feedback to people. It is quite a detailed methodology, but I think it's something that's worth investigating. And I think just to give some examples here, these are all kind of areas where people have used training within this industry, or TWI, to improve various aspects of work and creating, I suppose, what we would call standard work. So once we've agreed through our testing and implementation that these are the ways we should work, then these are things that can really help. So something like looking at clinical bundles, so something like the central line bundle where there are a set number of tasks, but it's really critical that they're done in the same way and reliably by everybody. And this brings in another concept, I suppose, that we think about more and more in quality improvement, and particularly in safety, is the idea of work as imagined versus work as done. And so we often assume that when we've taught somebody how to do something that they actually do it the way we would want them to do it. Well, actually, if you go and you watch people doing it, a lot of the assumptions here is that they don't do things. And that's not their fault, it's that they were never trained properly in the first place. So training within industry kind of, breaks down kind of the steps of each job and helps people kind of get these critical bits right. Now, the argument here is that you're turning people into robots or, disconnecting them and they're just, doing kind of a series of tasks. I really don't think that's the case, and I think that's not what TWI is trying to do. What it's trying to do is get people to really know what are the critical and crucial parts of work, especially around safety, and to engage kind of people very much to think about their work. And I think there's loads of opportunities here. And on the previous page there was a book by these two authors. Patrick Grope is a management consultant and a TWI trainer. But this lady here, Martha Purrier, is a nurse at Virginia Mason, which is a big hospital system in Seattle. And she's an oncology nurse, and they have used this really successfully there to improve their quality of care, in particular in oncology and nursing practice. So there are really our steps for sustainability, and I think at the end of it all is continuing to learn and improve, because even though we're sustaining something does not mean it can't be improved. And I think the goal is to keep an eye on that, and maybe to purposefully every now and again, not just because we have to, but purposefully to go back into quality improvement mode to see if we can improve things. So that's sustainability, and I think again, the principles of spread have some similarities, but they are different, and some of the approaches we use, in particular, let's say things like training within industry, where we can kind of package up really what the key things of what brings an improvement are. That really helps spread, but spread is a slightly different focus, and I think the main focus here is around context. And I suppose to start us off, I just really wanted to share a brief story, kind of, which I think makes the point here about spread. So Fordlandia is a place in Brazil, and the story here is that Henry Ford in the early 1920s, realizing the reliance that the motor industry had at the time on rubber has been a key component, not only for the tires, but for other parts of the car as well. Decided it would be wise if rather than shipping the rubber from Brazil up to North America, why didn't they just bring the factory that made the cars down to where the rubber was? And so he bought 2.5 million acres of land in the Amazon basin in the early 1920s, and they built a whole town there. And in that town, they were literally going to bring a piece of America down to the jungle of Brazil. And so they were very clear on that the rules that how people lived by and everything happened would be exactly the same as they were in America. They brought all the ideas that had worked in the Ford factories in America. And of course, it was a complete and utter disaster. within 4 or 5 years, the place had to be closed down because of revolutions from the staff, because they couldn't live and work by the same rules that were being applied in America. The environment was different, the conditions under which these people worked was different, the culture, the language, all of these things kind of pulled against what was lifting kind of what worked really well in one place and just dropping it into somewhere else. And so that's Fordlandia today. It's an empty place in the middle of the jungle. So how does spread work? Well, here's another model. This comes from another IHI paper from a little bit beforehand, so it's 2006, from our colleague Gail Nielsen, who teaches on the diploma with us. It looks at kind of what are the key components of spread. And to do that, they've created this nice model here. So at the top there, you can see, you know, it's about leadership. So it's about understanding what are the strategic goals that are trying to be achieved here. Do they align with what the organizational you know, goals are, whatever, you know, we're trying to achieve, and that there's day-to-day management recognized. So back to some of the things within sustainability, that we have ideas that work here. Really what we're trying to do is spread to sustain. In the middle part then, we've got obviously our ideas. So, you know, that we know what we want to do, but the setup is really important here. So, you know, who are the people who are going to be affected by this, but most importantly, who are the people who are going to be doing this? Who are our key partners? Who are the staff that will be actually delivering the change? And then it's understanding the social system that's going to affect that. And all around that are the ideas of measurement and feedback, and how do we get that knowledge out there. So you can see a lot of the ideas that we've talked about in sustainability are relevant in spread, but the important thing in spread is that idea of context. I think another methodology that's really useful when thinking about spread is this one that QID has endorsed, which is the idea of frontline ownership. This comes from Michael Gardam and his colleagues in Toronto, and together with the ideas of liberating structures, it's really about engaging frontline staff in deciding how the improvements that we're going to do are actually implemented. So it's not necessarily reinventing what those improvements are, but it's saying these are the things we want to implement and in order to cause the spread. But we're going to really, you know, respect local knowledge and local context to say, you know, how they would be implemented. And you can see some of the principles there from frontline ownership. You know, go slow to go fast. And to me, that means, you know, taking time to do some planning. Back to our Juran Trilogy. Taking time to understand what matters to people, who are the people who are going to do the work, what are the particular contextual challenges in this place. You know, again, some of the things there are, you know, how do we engage people better? Participation is voluntary, so rather than press ganging people into doing this work, you know, to try and make it something that people would want to get involved in. So using, you know, back to the previous slide there, you know, using kind of some of the principles of social change, making the invisible visible, you know, so talking about the challenges and the things that maybe the assumptions sometimes that we make, and how do we, you know, surface all of those and share them. So all of those, I think, are principles there. And again, liberating structures, if people haven't come across it, the website there has lots of resources, and also is a really excellent app to help kind of, you know, pick out kind of what liberating structures are most useful. And my colleagues, Rob Cunny and Juanita Geiser, they run a liberating users group here, and it meets in Dr. Stevens once a month. I think @LS users on Twitter if you want to get some information on that. One of the kind of the great theorists around spread of innovations and spread of improvement was Everett Rogers, who was a researcher. And people are probably familiar with this. You may have come across it in the Malcolm Gladwell book, Tipping Point. And this is called the diffusion of innovation. And it's a really useful thing to think of when we talk about spread. And it recognizes that for, taking up any change, that there are kind of, and we all have different roles for different changes. So there are innovators, people who are really interested in the change and maybe who are actually kind of inventing or testing or trying things out in order to find a new way. Then there's what we call the early adopters. And they're a small group of people who are often on the lookout for new and better ways of doing things. There's a large group then called the early majority, and again they're watching the early adopters to see, well, if this seems to be working, I'll get on board quickly. And then there's a point we call the tipping point where everybody comes on board, and then you get what's called the late majority. And then there's the last group called the laggards, or some people describe them as the historians, people who just don't like changing. And I think it's not fair to certainly to say everybody's a laggard on everything. There are certain things that somebody might be an innovator on, and other things they might be in the late majority on. But having this knowledge is a really useful way of helping you to understand and maximize your ability to spread. One of the things we often do when we try to spread is we try and approach the people who we often see as being most resistant. Well, actually, that's probably not the wisest thing to do. Starting with people who are the early adopters, people who are open to new ideas and working with them, that's often a much better way to get on board change. And Everett Rogers also identified a few other kind of phenomena that really helped to spread change. If you were doing something good, make sure that it was something that was easy to see, one of the things that people want to know is this, what's in it for me, so make it easy for people to see. This is an easier way of doing the work. This is a better way for patients. There's less complications. If we work this way, that things are safer. So make it easy to see that. So I'm thinking, again, things like the safety costs. If it's very apparent from your safety costs that using the skin bundle is clear, well, that's making that work observable. What's the relative advantage? Again, here the important things are both to patients and families, but also to staff. That this work is easier to do before. I remember in a project I was involved a number of years ago in the UK around getting people to use ISBAR, the handover tool. One of the relative advantages there was that people would finish their handover, in about half the time that they were doing it beforehand, but losing none of the value of it, in fact, maybe even making it more effective. But one of the advantages we could offer people was that you'd be finished work and out the door 10 minutes earlier than you would previously. Trialability, so again, that idea of making it easy to do the right thing. Often, again, when we spread, we switch back into our quality improvement mode. So even though we're spreading a new set of ideas, we don't have to go right back to the beginning of the testing. But we might start small, try them once, one day, one patient, and really kind of just, I suppose, get under people's anxieties, and often it's much easier to ask somebody to try something for a day than it is to ask them to change forever. Simplicity, again, trying to make things as easy as possible without making them, unnecessarily or unsafely simple, but the more simple they are, the easier it is to try out. And compatibility, the things that fit in with your organization's other approaches and ideas. Again, I leave the slide here, but John Berwick has taken those ideas again from Everett Rogers and come up with some principles for spread. So again, important things there. Maybe we've seen again in the previous slides. So find innovations. There's often no shortage of innovation. So find the right one, things that align with everything you're trying to do. Again, start at the beginning of that diffusion curve. Work with the innovators, work with the early adopters. Make it easy to see good stuff that's going on, and lead by example. And the last thing I'd just like to share with you is a kind of, it's a fun idea. Again, the reference is there. It does come again from the IHI, but it's this concept of the 7 spreadly sins. So these are the common pitfalls really that people make when they go to spread innovations. And I think it's a fun way of getting people really to see them and to talk about them. And I think one of the key things here is about awareness. If you're aware that these are traps that you might fall into, well, then how do we plan that you don't? So our first spreadly sin there is don't bother, testing. Just do big pilots. Well, we know from our quality improvement learning that that's not the way to do things. That start small, build up a degree of knowledge, but also by starting small, we get over people's anxiety of change. The second one there is about, just take what works and spread it unchanged. Well, I think that the Portlandia story tells us that really isn't the way to do things. We have to adapt always to local context. And again, planning that beforehand and learning about local context is really important. The third one there is relying solely on vigilance and hard work. That's just not going to do. I think, again, we need often to test and try out new methods for bringing proven changes from other places and adapt them as needed. The fourth one, and I think this is a really important one because, well, we do this, which is, give one person the responsibility and depend on local heroes. That's just not the way you're going to get sustainability. It's recognizing this is about everybody's responsibility, and the idea of what happens when you go on holidays, or what happens when you're not there. How do we ensure that the work, that the new ideas still are sustained? Fifth one there, require the person who drove the initial change to roll out the spread and be responsible for the sustainability of things. Well, there's nothing that's going to kill quality improvement initiatives more than that. That if you were, the person who was doing this work, that not only have you kind of piloted and tried out the changes, that you're now going to be expected to spread it everywhere and take responsibility. That's one way to really turn people off getting involved in this kind of work. The sixth one there is collect huge amounts of data. We know that's not sustainable. And again, back to the quality improvement principle of just enough data or the vital few. And recognizing that, as we move from quality improvement into quality control, we're looking at different types of data. Maybe we're looking at less frequent measurement. We're looking at measurement that tells us that the system is working rather than it can work. It's finding the right amount of data that's easy to do, measures that are easy to see and that are seen. And then the last one there is to expect huge improvements when you're spreading. Again, that's not going to be the case because you're going to have to adapt. Everywhere you try out ideas that have worked in one place, you're going to have to adapt them to there. And again, it's recognizing the need to slip back into quality improvement mode in order to get those changes sustained and spread. So these are the 7 spreadly sins. I think there's a little bit of wisdom in each of them, and I think you'll find them engaging because, again, they're about creating conversation with people and, like I said, making sure you don't fall into those traps. So I think we're pretty much at the end of things there. So just to conclude, you know, sustainability and spread are essential components of change and quality improvement, and really they're best thought of from the start. And I think as soon as you get into, you know, real work of quality improvement, where you're kind of, you know, you've learned the principles and you've seen that it's possible to affect change. I think from every improvement project you do, you need to be thinking, you know, how is this going to work without me? How is this going to work when I'm not minding it? What are the types of data that we're going to need to make sure that this is working as we go on? And really about design, you know, how do we redesign the work that it's easier to do? It's really about, you know, theory and method, and again, I think even though I haven't, I believe, given you the solution today, I've given you some tools and ideas that might help you find your own solution. Standardize where it's necessary. Like I said earlier, this can be a slightly controversial concept, and I think there's a bit of pushback often about it. But you know, creating standard work is important. You know, it's not to go beyond that. You know, because standardizing is hard to do, don't unnecessarily standardize. And we recognize as well the need for customization. So this is the balance we're trying to achieve, is customizing to what the needs of individuals, patients, families, what their wants and needs are. But one of the ways of ensuring that work is done is to try and make it standard. And then finally, you know, to you know, recognize the need for ongoing leadership, but in particular here, I think the need for an ongoing management system. And this is where I think sustainability and spread, they're not as sexy sometimes as quality improvement is, but unfortunately, that is where the rub is here. You know, you need to create structures and a discipline around the daily management system, and build it into the work that happens every day, that the things that we, you know, we set out to do, our daily briefings, huddles, handovers, trying to build kind of the parts of quality improvement into the normal daily management systems that we all have. And I think that's me finished. So I'm happy to take any questions, or I'd love to hear any comments. Thank you.
Great, thanks a million, John, and that was really informative. Lots of tips and tools there for people to take and hopefully use in their own workplaces. It's actually quite quiet, the chat box. Everybody seems to have understood you so well that we've nothing coming up there in chat.
There are some resources there as well.
Yeah, some resources there. So look, just firstly, we've people from all over the country. We've Tullamore, we've Cork, we've Waterford, we've Craigavon. And so that's great that you're all online. Just there, one from Michelle Howard, who's asking, is there any suggestions to maintain momentum or staff morale? Have any celebration to award achievements, doing work and presenting improvements, etc.? Yeah, it's that celebration, isn't it? Having time to take time to do that.
Yeah, you know, I think that's important. I don't think that needs to be any more complex than it is. I mean, I think acknowledgement alone is an important component of that. I think I've no doubt that people can be imaginative in ways of acknowledging folks. You know, that might be through celebration events. It can be something that's done online. It can be something that's done at meetings. I think there's a quote by Victor Hugo once that man needs bread and praise. You know, I think don't underestimate the value of praise. You know, of just kind of telling people and pointing them out. You know, that people have done a good job. You know, there are other things. I think you know there are meetings around the country where people can take their work, present it, share it with others. I think that's a great form of acknowledgement and praise. I think it's important that we do that. So, you know, I think there's no shortage. And I think, yeah, I think a good old celebration, you know, where people all go out, you know, every now and again. I think that helps to build team morale and momentum as well.
Yeah. Just one other example, actually, we're doing a project in conjunction with the NRH. I know some of them are online, and we are introducing a quality improvement notice board, a QI board, a celebration board. So there'll be like a project of the month, or people can put up ideas or, I suppose, innovations. So they're starting to think about doing like an innovation club where people can come together and brainstorm ideas.
Yeah.
And that links in nicely with that training within industry. One of the things that resonated with me was encouraging staff to innovate and giving it back to them, for them to objectively look at their own roles and their ability to change and to innovate.
Yeah.
Because often people aren't given that time to actually do that.
Yeah.
So is there any tips on how I suppose it's just releasing and giving people the time to actually objectively look at their roles and coming up with some
ideas?
I
mean, I think there's a couple of things there. One, I think is it's important for people who are in leadership roles to appreciate what you just said there, you know, that you need to create time and space for people to do this. And I think for leaders, that's about recognizing if something is important, then it happens. And so I think this is important. And I think, you know, part of it is about, you know, when you go back and you analyze why things are happening or not happening or why improvements are taking place, it's to recognize that sometimes it really is about paying attention to the little details, and there's no way out of that other than spending the time, you know, really understanding the work. How do I make it easy to do the work? So I'm going to think of something like, you know, improving the delivery of the sets of 6, you know, within an hour. That's really about understanding the minutiae of the work that's needed to happen there. What are the skills that I need? What are the tasks and the tools that I need? And a lot of this is about putting it all together in terms of making a sepsis trolley or something that you know, brings all those things together, that I'm not hunting around the place looking for it. Various ways of ensuring that people work together, that the specimens get off to the lab on time, that I'm reminded. But it's really about paying attention to the smallest details of the work, and then as much as possible standardizing that, so that as, certainly for doctors or for staff who move from ward to ward, that they're not having to reinvent the system that they put into action everywhere they go. I think the training within industry is interesting because I think it's just something that's emerging now as something that could be useful in healthcare. And I think that book I put up earlier is kind of one of the first that's out there. I think it's on it's actually on the last page as well, I think.
Oh, is it? Okay.
Yeah. But there's a very good podcast called the Lean Blog Podcast. And actually, they had, it's on the next one, I think. They had Patrick Grubb on that a while ago, and he gives a very nice explanation of TWI within healthcare. And I think it really is, for those who are educators, I think it's really something that could be useful. And I think it's not about making every task that we do you know, training that through training with industry, but it's about recognizing what are the critical tasks that we do. So, you know, critical procedures, and those procedures might be things like handover, and, you know, they're soft procedures as well as hard procedures. Okay, well, we're coming up to 2 o'clock, so we're eating into our time, so we might just take 1 or 2 quick things here. So Lisa Toland has said that she finds through her work that there's a lot of enthusiasm at Frontline, but it's not matched by leadership support, and that's a difficult bridge, you know, a gap to fill. And I suppose you've given great tips today on if there's anything else that you wanted to add on that. And Judy Toland has talked about how important it is to have data, and quality control relies on data and information, and that is one of the challenges at present. We need data, people, the skills and capacity to do that.
So that's a really good point, Judy. Then we have from Rose, she's great presentation, practical view of managing improvement, ensuring collaboration from the start for commitment going forward. And then we have from Irene, she's asking for, can you list any examples of large-scale NASA projects that have used this methodology to best effect? It may have started small, but gathered momentum with time and situation changes.
I think there are lots of projects, I suppose, that have tried to build this in. The one I was involved with last year, that's still ongoing very much, is the Pressure Ulcers to Zero, where I think people have been taking on these principles, notwithstanding the fact that it is hard, and the nature of that collaboration was to literally develop model cells or test sites where, maybe within a hospital, 1 or 2 wards would develop, ways to implement the skin bundle. So, we know this is a set of interventions that work, but then how you do it at each ward or in each care setting was going to be different. So that's ongoing work, I would say, but it's very much, again, back to getting all that alignment right. So, we can have these ideas and principles and tools, but we need to line it up with the leadership that's there. And then it becomes a question of will. If the will is there, then I think we can do these things. So I think certainly Pressure Ulcers to Zero is an example of something that has tried to build in sustainability. But I think lots of other projects have done similar things. Okay,
we're going to finish off with 2 really good points from Roisin and from Patricia. Roisin Eglinton has talked about the winning hearts and minds to sustain QI when managers are not committed to it. And she's talked about, again, that leadership clarity around responsibility and accountability, particularly for services deemed as being in crisis. Managers put their heads down to focus on fighting fires rather than examining ways to prevent a fire from beginning in the first place. Really good point. Thanks for that, Roisin. And lastly then from Patricia, if employees feel that they are throwing pennies down a bottomless well and they never hear a splash, they're going to stop throwing pennies. That's a great one. I've never heard that one before. Staff need to have their efforts and ideas acknowledged and supported by senior management. Absolutely, that's great. Any final thoughts, John, before we finish off?
Like all quality improvement, I would say it's learning by doing. I think the best way of taking these, and they are imperfect kind of tools and ideas, but it's about, trying them out, finding out what works for you. Not everything will be suitable. And I think the key thing I would say is to build in sustainability from the start, is to think, how is this work going to go on without me? I think you have a much greater chance if you think like that.
Great. So lastly, I suppose I'd really like to thank John for his time today and for his great talk and attention to detail. Thanks so much again for giving us your time. Just to say, we have got a number of WebExes scheduled before we take a summer break. So there will be 3 to 4 WebExes. We have Mark Roberts from Northern Ireland from Quality Improvement in the North is going to do a talk, and we also have one on audit and also patient engagement. So keep tuned, and they'll be coming out via the email list. And if you're not on that, you can email myself, Roisin Breen at hsc.ie, or Naomi Palisios at hsc.ie there on the bottom. So please email us if you want to be added to that, or follow us on Twitter at QITalktime, so all announcements will come through that. So thanks again for joining, and hopefully we'll see you again next time.